Healthcare workers got in their last-minute COVID-19 jabs at the Charlotte Maxeke Vaccination Centre yesterday. This week saw long queues of health workers wanting to be vaccinated. It's caused concern that many may not be able to get their shot before the Sisonke Trial wraps up. Phase 2 of the vaccination rollout starts on Monday. Heidi Jokos earlier went out to do status checks in some vaccination centres, and she's back in studio with me now. Heidi, so as far as I understand it, all vaccinations under the Sisonke Trial have now been concluded. How many health workers will roll over to be vaccinated under Phase 2?
So we don't know the exact figure, but according to the stats that we are aware of, if we have about 1.5 million healthcare workers and we also have and support staff, that means we still need to do just over 500,000 healthcare workers. So it's a very big number, but one must remember that Sisonke only targeted 500,000 healthcare workers and support staff. That's the dosage that we got, 500,000 Johnson & Johnson vaccines. For the Sisonke trial, we do know that that 500,000 target has not yet been met. Yesterday, when the stats were released, it was about 474,000, just under 475,000 healthcare workers. But of course, there's been lots of reports circulating that it was not just healthcare workers that got the jab under Sisonke, but we do understand that Sisonke says that, you know, they tried as much as possible to make sure that everybody that got the jab was either a healthcare worker or support staff.
And there are, of course, going to be glitches that need to be ironed out in the initial stages. Hopefully those do get ironed out. Which vaccines are going to be used for Phase 1B and Phase 2?
So we do understand that for Phase 1B and Phase 2, it will be Pfizer. That's all we have in the country at this stage, except those Johnson & Johnson vaccines that have not been used under Sisonke, but that cannot be used for Phase 1B and for Phase 2 because those were specifically for Sisonke. So we do know that the Department of Health has indicated they are still waiting for that over 1 million to be released from the Eastern Cape, the Johnson & Johnson vaccines. According to reports, it's because the international regulator needs to approve it and then release it. So it's going to take some time. We know there's a bit of a delay. Pfizer, however, is going to be crucial in Phase 2 rollout. We know the Health Minister previously said that Pfizer is going to be specifically for urban and metropolitan areas because it's 2 doses. It has to be kept at extreme temperatures. But we also know, Annalie, that, and this is very crucial, is that every Sunday we receive over 300,000 Pfizer doses at about midnight when that plane gets into the country. And we know that's going to be until the end of May. In the beginning of June till the end of June, we'll be receiving over 600 doses per week of Pfizer. So it seems as though the vaccines are coming in, but it's going to be a logistical process to make sure that they are inoculated with Pfizer, and all those processes and rules are kept to, especially because Pfizer is such a different vaccine compared to Johnson & Johnson.
Absolutely. And there also we see the necessity of the planning of the second jab kicking in. So far, we've only had to deal with a 1-dose vaccine. Now we're going to have to see how the government and facilities handle, logistically getting to people in time to administer that second jab. You mentioned earlier that healthcare workers this week were disgruntled with the process of vaccination. From Monday, South Africans over the age of 60 are set to join the queues. What's the state of readiness to administer these jabs? And I'm looking at your face already, and I know what your answer is going to be.
You know, Annalie, being on the ground and having covered this story quite extensively, I think there is a lot of panic, and hopefully the various departments of health within various provinces can try and communicate that they are ready for Phase 2, which is going to target 60 and above. We've actually just received a communication from the Gauteng Premier's office to say that there are a number of old age homes that they will be targeting, with various MECs going to the various old age homes to start vaccinating. But what's the big concern for Monday is the fact that many who have registered on the EVDS system, 60 and above, have not received their details as to where they're supposed to go on Monday, what time and at which vaccination centre they are expected to report to at whatever time it's their turn to get the jab. And I've actually put out a tweet to say who's received that SMS, with the majority saying we don't even know where to go on Monday. But the Department of Health has indicated once again that if you do not have a voucher, or if you do not have the exact time and vaccination centre you need to report to, you should not get to a vaccination centre unless you have those details. So Hopefully it's clearer on Monday, but I'm just worried that you'll have the vulnerable, the senior citizens in very long queues.
Absolutely, and that, given the fact that we're heading into the third wave, poses, you know, a very dangerous situation for people who do not have those details, ending up in queues only to be turned away, having possibly exposed themselves for no good reason. Lastly, before I let you go, what are registration numbers looking like ahead of that kickoff on Monday, both in Gauteng and on a national scale?
So as of the 14th of May, we do understand that over 1 million, those 60 and above, have registered. And this is quite a significant number, Annalie, given the fact that there was concern that those 60 and above, some of them in remote areas, some not having smartphones, were unable to register. But the department believes that this number will increase when they start going out, creating these mobile clinics, asking for those 60 and above to report to these clinics so they can register. So those watching that have not registered or unable to register, they need not panic, because you can go to a vaccination centre or a clinic and ask for help to be registered. It doesn't necessarily mean you'll be registered on the spot, but they will assist you with a registration number and so forth. So we know it's just over 1 million that have registered so far. Hopefully that number increases, because it's 5.5 million that government has allocated for 60 and above, and they want to inoculate 5.5 million by June. So they have a lot of work to get to.
Well, hopefully they get into that work very quickly, both feet in from Monday. Thanks very much for that update, Heidi Jokos.